Welcome to our rehab room. Now, as I said, Marco is going to be taking me through a few simple exercises. So he'll show me what I have to do before I have a go myself. And Marco, you're going to share with us some gentler versions of each exercise as well, aren't you?
Yeah, absolutely. Give you some regressions and also some progressions as well.
Okay, great. And we've got some equipment here, but that's just to make it look nice. You don't need any equipment, just yourselves to give these exercises a go. So what's the first one?
So to start off with, really basic exercise is knee rolls and knee hugs. So this is really beneficial to get you started if you're in an acute flare-up of pain.
Okay.
So we'll start on the floor or a flat surface like your bed if you struggle to get onto the floor, with your knees bent to about 90 degrees, and you're just going to gently roll your knees from side to side, just feeling a bit of stretch in the lower back.
Oh, actually feels quite nice.
And going as far as you feel comfortable to do so. When you come back up, you can hug one knee into your chest, or if you feel really confident, you can bring both in at the same time and feel that stretch in the lower back.
Yeah.
And then put your feet back down to where they were.
Okay.
And then you repeat that movement.
And how does this help if you've got back issues?
This just encourages your muscles to relax, contract, come out of that spasm, and hopefully regain a little bit of normal movement, as well as mobilising the spine in the areas that it should be mobilised.
Okay. And what's the gentler version for people who, I guess if you're in an acute phase of back pain, that might be a bit tricky, getting up and down off the floor? What could they do?
Absolutely. So you would do that into a chair. So come off the floor, find a nice comfortable seat to be in, and then you can just rock your legs from side to side, feel that twist in the back, bring your knees up into your chest as well.
Okay. And how often should people do this? How many repetitions?
We should do exercise as we feel comfortable to do so. So approximately 5 to 10 or 15 repetitions, aiming to do that 1, 2 or 3 times, but generally listen to your body. Do what you can, don't push it.
Okay, so that's a good one. What's the next exercise?
The next one, we're going to go into some classic yoga moves. So child's pose into cobra. So starting on the floor with your hands and knees about shoulder width and hip width apart. And then you can gently rock back onto your heels, stretching your arms out in front of you and feeling that stretch through the whole back, allowing your head to drop down to the floor.
I'm getting a few creaks and cracks going on. Is that okay?
As long as it feels nice, then it's fine.
Yeah, it's kind of a bit of a relief. So how is this one helpful?
So this allows your lumbar spine to go into a bit of flexion, it stretches your muscles, and it relaxes any muscle that might be into a spasm.
Okay.
From here, we come back up. We drive our hips towards the floor, lean forwards, look up towards the sky. Keep your shoulders down. And at the top, take a really deep breath out.
So this is one I still struggle with a bit, but when my back was really bad, if I tried to do that, say from the ground, I was just like this. My back just wouldn't bend.
Yeah, so
It's got a lot better.
by pushing up and taking a deep breath out really allows your spine to sink into the floor.
Yeah.
And I'd say don't stay here too long, transition back into your child's pose so you can combine the movement.
Okay, all right. So what about people who struggle with that? How can we make that a bit easier?
So you can make that easier by coming into a 4-point cat-cow. So back up into your starting position and then allowing your spine to just gently curve, tipping your pelvis forwards, and then the opposite direction, pulling your belly button up towards the sky, rounding your pelvis into that position.
Okay. Yeah. And how many of these would you do? Is this something you do every day if you can?
You would incorporate this into your exercise routine. So generally mobility exercises you would start with to loosen the spine up before you then go into your strengthening routine. And repetitions again, 5 to 10 repetitions, doing what you feel you can manage.
Okay. Oh, what's the next one?
So going into the next one is the bridge. So laying on your back with your knees bent and your feet on the floor with your heels in contact and your toes raised. By raising your toes, you put more load through the hamstrings and the glutes.
Okay.
From here, we're going to pull our heels into the floor, squeeze our buttocks, and just raise your pelvis off the floor, and then relax back down. Try not to push your spine too high up towards the ceiling. This is something we see quite commonly in people who have back pain. They use their back through this movement
Or is it sort of like this? There is a temptation to just lift up to there, isn't there?
Correct.
Okay.
So just squeezing the buttocks, that will flatten your spine, pull the heels into the floor and feel the muscles in the back of the legs working.
And I mean, I know I've got really weak glutes with my back issue and I can feel them shaking just doing that. It's a tiny exercise, but that's a strengthening exercise then, I take it. Is that the benefit?
Yeah, strengthening exercise for your hamstrings and your glutes.
And how can we make that a bit more gentle for people who are struggling or in a lot of pain?
Keeping the movement very similar, you're just putting your feet flat on the floor and bringing the heels a little bit closer to your bottom.
Yeah.
And then repeating the same movement, squeezing the buttocks and just raising up.
Okay. And how often would we want people to do this one? Again, is it same as before into your regular routine?
Yeah, there's no set hard or fast numbers for your exercises. It's what you can do comfortably. So if you get to the higher ends, 15 repetitions, and it's painful, reduce that down to 10. But generally 5 to 10 is a good starting point.
And if you're doing it for the very first time, should you just start with 5, just a low number, and see how you feel?
Don't jump in at the deep end.
Yeah.
Start off nice and easy and gradually build up.
That's what I think sometimes can put people off, isn't it? Because if you don't do much, something like that is actually strengthening your muscles, if you do quite a lot of it, it's actually normal to have a bit of pain and tenderness for a few days, isn't it? Because that's the muscles building, and that can get confused with the other symptoms you have.
We commonly see people come back and say the exercise has made my pain worse, which is a good thing because we're targeting the right areas. So we just need to regress that, reduce the capacity and then progress over time.
I always say to my patients, look, if you're working with a physiotherapist and they're guiding you and it's a bit sore afterwards, it's fine to increase your painkillers, take some painkillers on those days to enable you to do the exercise.
Definitely, use your medication to help you do your rehab.
Yeah. Okay, we've got one more exercise.
Going into a squat, so a bit of a harder exercise to do. So stand in with your feet about hip width apart. Hands out in front of you really gives you a nice control and balance. And then we're going to just try and sit down as far down as we can go towards the floor and then come back up.
That's a nice deep squat you're doing there, Marco.
If you feel that your back starts to bend, stop like there and then come back up.
Okay. And what's the benefit of this?
We're loading in a weight-bearing position. We're trying to put as much resistance through the quads, the hamstrings and the glutes. This is a full body exercise.
And how can we make that one easier for people?
Again, accessing a chair, so sitting down and starting in the seating position and then just coming into your standing position without using your hands and lowering yourself back down. The chair gives you the beauty to have a little rest and take the load off.
I love that you're doing sit-stands. I recommend sit-stands to all of my patients all the time. If they're starting off with any form of exercise to try and get a bit of strength, sit-stands are a really good way, aren't they?
Lower limbs and the strength in our lower limbs are the foundations for our spine. For longevity, we need to be strong in the legs to support the back.
And for someone who is just starting out, how many should they try and do initially and what should they work up to?
Start at numbers that you can feel the exercise working. If you can't feel the exercise working, it's unlikely doing anything. So if you feel your muscles working at 5, stick to 5 until it feels easy and then progress up through the numbers.
And you're starting to get ever so slightly out of breath there, aren't you? Just a teeny tiny bit. Me too. So these exercises, they do make a difference even to people who are super fit. If you gave those exercises a try, or if you have any tips, then please do share them with us. Anything that helps you get a bit more movement in, we'd love to hear it. So those are some basic options, but it's always a good idea to speak to a professional about your specific concerns. That way you can get a personalised programme that's perfect for you.